Have you ever thought about making your own podcast? Okay, so you have your script. You ready to record? So now what? Anchor, a podcasting platform, can come to your rescue. I use it for my podcasts because of the ease of having Anchor distribute my episodes on other podcasting platforms, such as Spotify and Apple Podcast. It's a free platform with its own creation tools that make it easy for you to record and edit your podcast right from your phone or computer. And the best part? You can make money from your podcast with no minimum listenership. Now that's a good deal. Download the free Anchor app or go to anchor.fm to get started. Anchor.fm is everything you need to make a podcast, all in one place. And now, on with the show. The journey of self-discovery is never a simple one. Understanding one's mistake and trying to make amends within oneself. How can you do that? Maybe try and find some self-destruction to make yourself feel euphoric? But it's only temporary. But your courage that you have is not. You just need that one moment of clarity to be able to swallow the courage whole, and then things start to make sense. The defense mechanism that you can have can sometimes help keep the monsters at bay. But most of the time, the barriers are not strong enough to withhold the reality of the situation. This isn't another aspect of trying to fit in, or to be skinny enough to be adored by everyone, because it would never be enough for the one person that matters, yourself. So what would be the point of starving? The point being the control of the self-destruction, the feeling of bliss that might come with it. Each journey is different, and it's only in your worst state, at rock bottom, when the fat is chewed, when the conversations have been done, you can have the time to get to the bone of how harrowing this journey is, of how you need to feel the exact thing you were trying to protect yourself from. We are two takes, and this is one shot, an analysis of the film To the Bone. Ellen, a 20-year-old, has a disease, anorexia nervosa. She has been to many inpatient clinics to help her come to terms with her illness, however, all have failed. Within this story, we find her being recommended to try another inpatient program with more unusual methods by an equally unusual doctor. From the location being a regular house to there being no doors in any of the bedrooms, this is a different set of rules being monitored. Throughout Ellen's first couple of days, the rules are explained to her and to us, with Ellen's reactions demonstrating that this is a unique technique and perhaps maybe even uncalled for. The difference of what she was like in her most recent program, defiant, controlling, patronising, this inpatient program, unsure, hesitant, social, and polite, might be another turning point. Or it might be because she is new. Whatever the case, the interest lies in what she is told to sit down with everyone at dinner, and the fact that no one is forced to eat if they don't want to. It's the mere act of being sociable that constitutes the behavioural freedom to eat anything you want, or nothing at all. Dr. Beckham does want to help, but it's in the patient themselves whether or not they are going to make those conscious decisions of wanting that assistance that constitutes their place in his programme. Immediately, in Ellen's first meeting with him, he is honest and gets to the point. He does not make Ellen feel bad or better. He states the facts about her condition. He suggests his programme various rules such as not speaking about food as he finds it boring and unhelpful. And Ellen is naturally resistant. What is interesting is that he does not have the patience to make her see sense, hence his explanation that if you want help, I will give it to you. If not, then you are on your own. Through this first meeting, the rumours are true. Dr. Beckham is different from the other doctors. To see this difference, we need to look at Ellen's family and friends and their relationships with Ellen. The first people we encounter within Ellen's family circle are her sister Kelly and her stepmom Susan. Susan is seen as the wife that wants everything to be good and perfect. Her constant disappointment in Ellen and the trivial things around her, the things that she has sacrificed for Ellen, suggests she is wanting to make the whole situation come to a better conclusion by encouraging Ellen to face the facts, to make her see how disgusting the final result of what she is doing is implied on herself and on Susan. Saying things like, "Do you think this is beautiful?" indicates her lack of understanding of the illness. Fearing points to what one looks like on the outside, when really it's about the struggle on the inside. Susan does not understand, only seeing this illness at face value. Looking further and making cakes that look like a burger and fries with the caption, "Eat up Ellen," emphasizes her lack of understanding even further. She only sees it as a face value, when the illness is much more than what's on the surface. But she wants to help, even when her final piece of advice, "Be good, not perfect, just good," places the possibility that she's only asking for some compliance, not perfection, as deep down, understanding Ellen the way Susan understands her, from how we, the audience, perceive this relationship, Susan knows that there isn't a thing as perfect when faced with this disorder. She does care. She just has a strange way of showing it. And reflecting on Ellen's reactions, she knows she is trying. Kelly, Ellen's sister, is the person Ellen relates to the most. They laugh and have a good time, with Kelly wanting to spend time with Ellen, even if it means walking long distances and only drinking alcohol with no food. Though she understands, and even remarks on how Ellen is trying to trick her, Ellen never fully fesses up to her schemes, but rather says things such as, "The view is better at the top." Kelly just lets her be, sometimes letting Ellen indulge in things that Dr. Beckham has no patience for, such as the calorie counting. Kelly shows the difference between inpatient programs and shows how Ellen is a person when she's free to be herself. It is within Kelly that the proper feelings are expressed in the family group therapy. It is within Kelly that she expresses concern for Ellen as a person and how her illness is affecting herself and Ellen by the memories she remembers. She asks Ellen bluntly, plainly, to try and get better, to try for herself. Ellen sees her sister as her comfort, her ally, and perhaps like her conscience, she says the right things even if it is hard to hear. Ellen's mother, Judy, and her partner Olive are sporadically involved in Ellen's healing process, with their home and their words being the last location and prompt to make Ellen see sense. Judy is seen as a very caring mother that is almost apologetic with the things that she cannot handle, with a conversation about her breakdowns being included in the script, to almost give an explanation as to why she cannot cope with various things. Her partner Olive, being the more sturdy one, sees that it's up to Ellen to figure this out, in her own way, in her own time. She is there like a rock, for stability rather than comfort. Two sides of the same coin, they want to help but say they cannot. So for the most part of the journey, Ellen feels like she is alone. Her father, the last piece in the puzzle, and I might add, the only male influence in her life, is not present in the entire movie. His absence is obviously seen as a disappointment, what with Susan giving excuses after excuses. However, this gives rise to how important the male characters are in relation to Ellen and how they help her. Luke, the eccentric British ex-ballet dancer, the only male in the house, is categorised by his want of expression, a positive outlook on life that is helpful for the upset housemates and also addictive in various circumstances. He is the only one that, though sometimes does not know when to stop, is the one that makes Ellen feel and think differently. He is the one that chooses Ellen to go with her in his dinner date, to eat at a recommended place, and make eating a state of checking something off a list. Though he eats, Ellen does not. And much to their amusement, they use this to initially pretend to be cancer patients and get free beer. Though sometimes the illness can have some benefits, as this scene has told us in effect, this is not long-lasting. He's not afraid to argue, to fight his corner, but knows when to give in. Much like Ellen's sister, he is there to help and perhaps tell her things she doesn't want to hear. Anna, a bulimic patient, is a bubbly and helpful young woman who is also an inpatient in the same house as Ellen. She gives off the vibe of wanting to be there for others, which is true, but looking further into her behaviour, she is tempting to trick the system. We see this when she helps Ellen with her bags in order to get points straight away. The more points you have, the more fooding you get for good behaviour. Though she doesn't think about food, like some other patients, she is sly in her behaviour. One primary example is when she went to the movies by herself, ran all the way back, and placed vomit in a bag underneath her bed. Ellen finds herself cleaning the sweat away with wet wipes late in the night, and Ellen decides to give her mutual destruction in the form of doing sit-ups in her bed. A trust has formed, but the rituals of throwing up are still there. It gives off the impression that Anna might not be getting better, but getting better or perhaps beating the system. That is, until it comes to weighing with Lobo, the caretaker. She cannot pretend or talk her way out of the numbers, therefore Anna might just be what Ellen used to be, pretending to be better in order to make the freedom she used to have, but all in all, not helping herself. Dr. Beckham, understood to be an unapologetic workaholic, enjoys his work and wants to keep it that way. His professionalism stems in his effectiveness of getting things rolling and to understand his patient better in person, rather than what is on paper. When he sets up the group therapy session, Ellen's whole family is there except the recluse father, making Dr. Beckham to be the only male. Ellen shows reluctance, and rightly so, but Dr. Beckham encourages this, making it seem like a curious venture rather than a necessity. And so, it happens, and we see each character's behaviours collide and crash. Immediately there are arguments, with Dr. Beckham being the mediator. Though only a small aspect of this meeting was shown, it gives the example that many of the parent figures encourage the aspect of blame and self-preservation. They blame each other for this outcome, when really Ellen only blames herself. But what really hits Ellen is her sister's response to what she thought about all of this. She does not blame anyone, but rather reflects on how her life is not her own, how she looks at various photographs that should have been good memories, and that only sees things that are related to Ellen, such as her fainting when Kelly was at prom. It was not about only Ellen, but Ellen, after the therapy session, is saddened by the reaction. And again, does not eat. But what is even worse is that she does not even hide it. To fully understand the illness, let's take a look at the causes and health risks. The causes of anorexia and bulimia can be related on many things. It can be emphasized by other members of your family having a history of eating disorders, depression, alcohol and drug addiction. It could be anything as small as criticism for your eating habits, body shape or weight. The overall concern of being slim and seeing yourself as not slim enough, or having pressure from society or your job, such as a ballet dancer or athlete or model. You might have anxiety, low self-esteem, an obsessive personality, or you're a perfectionist, or have unfortunately been sexually abused. In Ellen's case, very small bits of information, primarily about her mother having postpartum depression and mental breakdowns, can relate to a couple of these causes. Ellen herself, however, with a story beginning from a Tumblr post and the act of someone liking her art so much they kill themselves, has her torturing herself for it, and feeling the pain by not feeding herself. The health risks of this disorder, especially long-term, can lead to severe health problems associated with malnutrition, problems with muscles and bones including feeling tired and weak, with the heart and blood vessels leading to poor circulation and irregular heartbeat, heart failure, and low blood pressure, and perhaps with the brain and nerves, including seizures and difficulties in concentration and memory. Other things are affected such as the kidneys and the bowels, including having an overall weakened immune system and anemia. Other problems can occur such as fertility problems and lack of sex drive. We can now understand that some of these symptoms and health risks are respectfully included in the film to bring forth a more realistic look at this disorder. Treatments can stem from CBT to a specialised supportive clinical management and, of course, inpatient treatment. In this story, in this particular inpatient treatment, Dr. Beckham talks to his patients like any other person, even trying to express what kind of message he wants to give in the way of artistic expression. Not to the point of them doing arts and crafts, but by realising and relishing the art in real life. This comparison, from first meeting Ellen in an arts and crafts lesson where she makes a poster using a funny but obscene reference to balls, has her now walking into an art installation where water drops from the ceiling but stops in the vicinity of your body, making you feel like you're walking outside of water that is around you. From Ellen's reluctance to absolute wonder, and perhaps fun, takes a turn in this expression. To appreciate that life is all around you, and even that it is not. As the small conversation after the exhibition will show, Ellen needs more than this. She understands this already. It's all about her inner struggle, and even the small relief of a doctor telling your inner voice to go fuck itself can show that this doctor, The small band of people on the same journey as you are behind you, and it seems, at this moment, a connection of kinship is made and a support system is set up. Another housemate, Megan, is the oldest of the bunch and is pregnant. This is seen as a wary but quietly joyous event. She is hesitant to have a baby shower and fully commit to the idea of having a child, promising the rest of the housemates that she will only have a baby shower when it's turned 12 weeks or more, hoping not to jinx it. When it is time for the celebration, Megan reveals that she's beginning to feel happy about the fact that she has something besides herself to care about. This understanding might slowly help Ellen to realise that there are other things that one can care about. This act of ignorance and nonchalance to everyday wonders cannot hold true, especially when there are other people around you glowing with this feeling. It's infectious. When unfortunately Megan loses the baby, screaming she thought she was safe, it gives the indication that the idea of receiving and giving life can be snatched away, and this illness can once again affect those around her. That it takes a certain amount of courage to pick yourself up and start again. It is in the small things that we see it. The child's first step, as awesome as an earthquake. The first time you rode a bike, wallowing up the sidewalk. The first spanking when your heart went on a journey all alone. When they called you crybaby, or poor, or fatty, or crazy, and made you an alien. You drank your acid, and you concealed it. Later, if you faced death of bombs and bullets, you did not do it with a banner. You did it only with a hat to cover your heart. You did not fondle the weakness inside you, though it was there. Your courage was a small coal that you kept swallowing. Throughout the film, Ellen, given the new name of Eli, is affected by what is happening around her in an astonishing but hesitant state of either happiness, the art exhibit, the baby shower, Luke, and the dinner, or sadness and loss, Megan's loss of her baby, Eli's troubles with her family, group therapy, and her condition. Her new identity was the spawning point for new thoughts and feelings, starting again in a new place. Though it worked for a while, the increase of real and saddening situations overwhelms her. Her idea of remaining safe through the damage she is inflicting on herself is childish and cowardly, contradicting the poem just recited by Anne Sexton. Eli, again and again, does not swallow her courage and step up to the plate. She cowers and stays in her pain. Why? Because it is comforting, because it is what she knows. When trying to get counsel from her doctor, Dr. Beckham does a 180 and says it how it is. Bad things are going to happen. It is non-negotiable, but what is how you deal with it. And this is true. But Eli cannot deal with this, and thus goes back home with her mother and partner in Phoenix. A couple of things happen here in the last scenes. Eli, in a private conversation with her mother, finally lets go and lets her mother in. The concept, though an interesting premonition, has Judy believing in them and having the courage to ask Eli if she can feed her like a baby. The premonition came to her of Judy somehow blaming herself for what is happening to Eli. But what makes Eli break down and let her feed her is her mother's acceptance of if Eli wishes for death, then her mother cannot stop it. This hits Eli hard, realizing that her mother, always on her side, is never meant to fight her battles, so she stands by her daughter in whatever decision she makes. Another scene, when the feeding is finished, has Eli waiting until her mother and partner are in bed, so that she can walk in the desert. The walk is purposeful, but with no direction, and for the second time, Eli faints and falls to the floor. This is when she has a vision. Various things come to light and can be perceived in a very interesting way. The fact that Eli wakes up in a healthy condition in a white dress can present the idealized version of herself, the pure and the good. Whilst this pure and good Eli gets up from the floor, Luke is there to greet her, giving her honest compliments and making her feel good. Her walking towards a tree with the voices of her family in her head can mark the cycle of bad thoughts that have dwindled down into an echo at the back of her mind, because of the awe of this vision. She sees a tree, its unique placing in the desert personifying the beauty it holds within this life. There are moments when Eli is presented twice in the same scene, perhaps emphasizing a near-death experience, a personal perception of each scene. When this happens, she is leaning up against a tree looking up at herself in the tree with Luke. Does this show the possibilities of different thoughts, different journeys, or different paths that can be shown? And why is Luke being centre stage here in her experience? Because she is realizing her feelings for him. They come to her in a rush, in urgency, because when he asks for her to look down, another wave of realization hits her. She is seeing her own worst self. It is an ultimate wake-up call, and Eli, seeing it for the first time, realizes the control this illness has on her. For perhaps the first time, she is seeing what everyone else is seeing, and it is not pretty. The last moment of the vision is when she is handed a small piece of coal, and like the poem, it is her courage and she must swallow it. Seeing that this is perhaps the best option, she swallows it whole. This makes her wake up in the reality. Her lips are chapped. She has an unhealthy glow to her complexion, and her clothes are back to being dark-coloured and baggy. She wakes up coughing and finds happiness in being alive. It is time to change. What is interesting is how this want and need for change happens almost instantly. The main thing, apart from going back to the inpatient program and attempting to try and get better, was her mannerisms, especially towards her stepmom. Always silent and answering her in small sentences, she finally embraces that Susan is trying to help and hugs her openly. Her sister understands this change and greets it with open arms. Susan, naturally, is quite taken aback, but given the change, when everyone says goodbye to Eli, to go back to the inpatient house, Susan willingly hugs her stepdaughter, understanding that she is letting people in, finally and hopefully, for a long time. If you enjoyed what was said, please follow me on Anchor and Spotify. Be kept in the loop for new episodes by following my Instagram. And if you have any questions, email me at 2takespodcast1@gmail.com. And as always, thanks for listening.